My name is Tom Bradley. I'm British photographer. Been working full-time professionally since about 2009. And I photograph various things, mainly sort of documentary type work. But since 2009, I've also photographed as a constant leprosy, and I photographed that across, I'm not sure, about 13, 14 countries, maybe, in mainly Western Central Africa and South Asia. So including India and Bangladesh. And it sort of came to me, it came to me rather than I decided to consciously start photographing leprosy. I had a couple of friends that had volunteered at a leprosy hospital in Nepal. And it was just very easy to set up the connections there. The charity was based in London, close to where I was brought up. So I went off there and went out to Nepal, photographed for 6 weeks at this hospital. And there I met, I think it was meeting quite a few people, but specifically a man named Dr. Hugh Cross, who is a well-known podiatrist working with leprosy, and conversations with him sort of vested my interest in it, and I decided to continue. And what was a sort of 6-week project to understand something and hopefully get some photographs out there became 1 year, and then I went to Nigeria after that. And initially I was sort of funding my own way and working with NGOs, and then it expanded more, and then I got a couple of years later a big commission from American Leprosy Missions to go and photograph in the Congo, which was amazing. And after that, I started photographing more and more for other organizations, working more back in South Asia, as well as Western Central Africa as well, which at some point, of course, led me on to Lepra, mainly via Dr. Diana Lockwood, who's now a retired, but never quite retired, leprologist, one of the top leprologists in the field, very well respected. And she's got a project called A New Face for Leprosy. She photographed that with someone else, but the idea was to change some of the imagery surrounding leprosy, especially now that everyone has access to the internet. People that have been diagnosed with leprosy in India and Bangladesh, for example, just Google it, and the first images that come up tend to be quite shocking, often quite old medieval depictions of leprosy, but then photographs that go hand in hand with those sorts of things, which does happen, but is very late stage leprosy. And so she wanted to change some of the imagery to give people hope that this was a disease that can be very easy to fight with the right education, healthcare and funding. But my work with leprosy has continued all these years, and I think still will continue. So I think, yeah, I mentioned before, but one of the things that I'm trying to do as a photographer for this is capture honest portraits. It's portraits mainly, that don't try and a photograph can easily, I don't want to say mislead, but it can lead you to think something very specific about a person. You photograph someone when they're sad, and especially if it's someone that's quite poor living in Bangladesh, you can think, oh, well, that person's sad all the time, and because they're poor, they've got leprosy, and that's not always that helpful. And photographs should convey some of the complexity of what it is to be a human. And so I suppose one of the foremost things of this is to photograph people as people and human beings before people affected by leprosy. So not all of the photographs show, even if they have some sort of disability as a result of leprosy, they don't always show that. It sort of depends on the circumstance and the light, and some of them do. And so the collection as a whole hopefully conveys the complexity of different lives, and there'll be ones that are happy, and there'll be ones that are maybe more somber, and ones that show people that have quite bad damage, and ones that show no evidence whatsoever of leprosy, which is often the case. Sometimes some of the people we photograph were diagnosed early, they had no problems, and that's a very important part of the story as well, because that should be the case every time. That could be the case every time, in most cases anyway. There's always with every disease, there's sometimes complications that are beyond medical help, but they tend to be fewer, especially with leprosy. So yeah, and Diana was doing quite in-depth interviews with people, usually before we got photographs, and a few times as well I had a small, well, not so small, but a Polaroid camera that made small images that people could write on. In the tea gardens, not so many people were literate, a few people were. But then we went to a place called Boggara, which is in a further west and different part of the country, and it's flatter, very green, very beautiful. And there were more people there that could write. But yeah, I would say more than half the cases of people we photographed were illiterate. So you see, leprosy tends to be found with people that have no education. That's certainly one of the big factors. I'll just to quickly put it in context. So I visited there first in 2013, and but on a commission from an organisation photographing leprosy. And while I was there, came across photography school that rather impressed me. So I actually went to study there for 6 months from 2015 to 16, having worked 6 years as a professional, but never studied. And I thought this would be interesting to push me. And so I've been back a lot. I then worked at that same school the year afterwards, coordinating the course, and I photographed all over Bangladesh. I've got various projects there, so I know the country very well. I've been lucky enough to have travelled there more than probably 95% of Bangladeshis. So I do know the place quite well. It's got a lot of problems still in terms of healthcare, and making sure that healthcare reaches out to the poorest people, and to get good treatment, it tends to be a privatized system. So people that are wealthy send loved ones to a couple of very specific hospitals in Dhaka. But as such, good healthcare is distributed very thinly in the country. And the jobs of many of the organisations there, the NGOs, are to support those healthcare systems, and many of them work hand in hand, which is great. But yeah, there's with leprosy, it's quite interesting. It's a very dense population, and India has always had the vast majority of leprosy cases, and still does, but it's a much bigger country. But one of the areas where we went to this time for the New Face project, which is Bangladesh, is generally very, very flat, and this was one of the slightly less flat places, slightly hilly, and it's where a lot of the tea gardens are. And you have a lot of tea garden workers there that tend to be Hindu communities, and there's various they have very specific working conditions and places where they live, and there's various I think it's fair to say controversial working conditions and how they're kept by the companies that own the tea gardens, some of which are British. Um, uh, and recently, they've always had leprosy in those areas, but very recently it's been noticed that there's been a sharp rise. And so if that carries on, that small area of Bangladesh is likely to be one of the most endemic places in the world for leprosy. And this is not unique to Bangladesh, but a lack of funding in healthcare systems surrounding leprosy means that there's a lot of doctors that don't always recognize it. And so it gets misdiagnosed a lot. And Diane and I saw this a lot on this trip. Early misdiagnoses of leprosy, which the two big things that results in is obviously a later stage of leprosy coming through. So one of the things that leprosy does is damage the nervous system, so you can't feel things on your hands or your feet, which means if you get a cut, you can't feel it, and it won't heal as quickly if you don't consciously rest it. And if you're a working farmer, then you're not going to. But you see later stage of that. So this is the nerve damage spreads that can become permanent. And so even if you then take the medicine to kill the leprosy bacteria, that nerve damage can stay. And that's one of the big problems. So we're seeing cases where that shouldn't have happened if they were diagnosed early happen. Yeah, which is disheartening. Because where there's been funding in national programs with leprosy and where there's been good funding for organizations, then this education amongst doctors and nurses diagnosing has been quite successful. So there's no reason that it needs to be there. And of course, the other thing, if they're not diagnosed very quickly and they're going from doctor to doctor, in a country like Bangladesh, they can spend a lot of money. And these tend to be people that are not very wealthy in the first place. And you've seen people that have own a bit of land, enough that they can get their kids educated, that they can have a family life, usually quite basic, certainly by Western standards, having to sell all of their land just to diagnose something that ultimately, when it is diagnosed, is free treatment and free healthcare. So yeah, that was really sad to see, and we saw quite a few cases like that. So she is, and you can see she's wearing the full niqab burqa here, which she does anyway. She's comes from relatively conservative Muslim family, but she's also not told her husband that she has leprosy. She doesn't have any strong symptoms at all, but she's been through that. She's taken the medicine, and she's become since quite a big advocate in the community and coordinates various sort of self-help groups in the region where she is. And what she said she wrote, and she just knew what she wanted to do, and I said, well, let's write on it this way. And she just wrote a diary of her life, of her time affected by leprosy, and I said, write freely. I think I don't think she's mentioned any names that are going to, she's not going to be identifiable, but she was actually quite relaxed. She said, I don't really mind, the chances of anyone finding this are very small. But yeah, it's always extraordinary when that happens. And I think it's very powerful when, this is why I do the Polaroids and ask people to write on them, is because this is them speaking, this is their message. This isn't myself or Diana translating what they've said or editing down the conversation to a little snippet, but them choosing the words that they want to say to people. And there's usually a conversation about that, because it can be quite daunting being told to write a sentence about something personal. But she had a lot of space and she just did it. And I think it's wonderful. Yeah, she's made it a piece of art. So we'll get that translated, and yeah, it'll be her telling her own story. Um, so yeah, that's one of the things that's part of this new face, and I wanted to do that a bit more, but you just don't meet that many people that have a not just the ability. It's not just about education. Like, it takes something quite special for someone just to write down a stream of consciousness and be okay with putting that out there. But it happened this time, which is nice.